right. Looks like we are live. Good morning. Okay. Okay. Don't know why that's not working. There we go. All right. Good morning, everybody. Good morning. Does anybody have any questions over the homework? You had chapters 8 and 9 over the weekend. Any questions? No questions? This is the last Monday of class. You guys graduate on Wednesday. It goes quick. It goes really quick. No questions about anything. Everybody good? All right, let me go ahead and get your scores for chapters 8 and 9. If you did not get to it, just tell me pass, and we'll get it next time. Paula? Olivia?
I only got to chapter 8, but I got a 95.
Thank you. Cindy? Gabriella C?
Chapter 8.
Okay.
Chapter 9. Yes, 1.
Okay, very good. Melissa? Ariana? Fabrice? Brianna D?
I got 100 on chapter 8 and a 90 on chapter 9.
Thank you. Antonio?
100 on both.
Thank you. Gabrielle H? Daniel?
Wrong on both.
Thank you. Drew? Brianna R? Do you have 5, 6, and 7 for me? If not, I can come back to you. Okay. Amara?
100 in both.
Do you have 5, 6, and 7 for me?
100, 690, and 795.
Thank you. Mahala?
I made 100 in this one.
Okay, they're very good. All right. Any other questions? No? All right. One class left after this. Wednesday. Today is our last skills day. So we are finishing up the skills today. On Wednesday, we're going to be going over important information. Things like how to renew your certification, how to get your continuing education that you're going to need to renew. You don't have to retake the test again to renew, but you do have to meet certain criteria. And we're going to go over all of that on Wednesday. We're also going to talk a little bit about finding a job in healthcare because it is different than other industries. So we need to discuss how it's different and what you can do to help maximize your employment opportunities. And of course, you need to register for the test. If you haven't done that yet, it needs to be very high on your list because the longer you wait, especially once you're done with class, the longer you wait, the more likely you are not to test because your confidence level will go down. So if you haven't registered for the test, make that a priority. Otherwise, you're likely not to go test. And I don't want you to not fulfill your dreams, right? You guys are all here for a reason, because you want to enter healthcare. So game show will be next Tuesday. So after we graduate, next Tuesday, I'll have the game show. And this is a really good one for you guys to participate in because it's right before you go test. So it would really give you a good idea of the types of questions you would see on the state exam and give you a chance to discover how you would answer those questions, right? A good practice test for you. So next Tuesday will be that. This is not you. Your CPR class is going to be next Monday. If you haven't registered for that, you might want, and you're planning on taking it, you might want to register today because she will end up closing enrollment. So, because she needs to finalize the roster about a week out. So if you haven't registered for the CPR and you want to take it on Monday, register today. Otherwise, you'd have to wait until the next class session if you want the discount. All right, so now we're at the point that we start thinking about work. We're almost done with the skills. The test is coming up. Graduation is Wednesday. So you're probably starting to think, okay, where am I going to work with this? And if you have an idea in mind, that's good, but that isn't necessarily the right place for you. And what we find, unfortunately, is a lot of people go through a CNA class, they get their certification, they think they want to work at the hospital, and they get into the hospital and they realize, oh my gosh, this is not for me. And then they leave healthcare. And that doesn't do anybody any good. That means you've wasted all this money and all this time, and you're not filling the openings that we have. So we actually need you out there working. So I developed this quiz. It took me 2 years to develop this quiz. There's a lot of psychology in it. It's only 19 questions, but it's going to be based on your personality as to where you might want to work. So a lot of people think, I want to work at the hospital. I think Grey's Anatomy has, kind of pushed us in that direction. But that may not be the right place for you. It might be. But if you are the type of person that doesn't do well with change, the hospital is all change. There's admissions and discharges, and the patients you start out with are not the patients that you end the shift with. There's a lot of chaos, and you've got to have really good coping mechanisms to work in a hospital setting. My oldest son, I love him to pieces, but he is not good with change. That would not be the place for him. Make sense? Okay. Now, good morning. Now, on the other end of the spectrum, you have very routine-oriented career options. Things like nursing homes or assisted living facilities where you're dealing with the same patients every single day. And not a whole lot changes. If you are routine oriented, then you might want to look at a more routine focused setting. Does that make sense? If lots of machines intimidate you, well, then you probably don't want to work in a facility that has a lot of machines. Good? Make sense? But you also want to look at things like opportunity for advancement, the ability to learn new skills. If you're the type of person that likes to learn, that's going to factor into it. Like, I am not a routine person. I like variety. I get bored very easy. I have to be challenged. And if I'm not challenged, I'll make something up. I will create a challenge for myself. It's just my personality. I like to problem solve. So working in a routine environment, not good for me. Not good for me. When I was working in the ICU, loved it because it was always different, right? There's always a problem to solve. When I worked at hospice, that was awesome. I loved being a hospice case manager because there were lots of problems to solve. So you have to figure out what your personality is and what setting matches that. And this is hard for you to do at this stage. You don't know what each area is going to require from you. So I made this quiz for you. It's free. But this is something that you really do need to do before you start to work. Good? Because I don't want you to leave healthcare. And we're going to talk a little bit about this on Wednesday, but if wherever you end up, if it's not the right place for you, if you, what happened? Hold on one second, guys. I don't know what happened there. Where's my mouse? Okay. Testing. All right. Well, we'll do that. That's weird. Technology. All right. If you get into a place and you decide it's not the place for you, go look for another place. Don't leave healthcare. Because usually the reason that we don't like jobs is not because of the job, it's because of the people we work with. So make sure that you keep that in mind. We need you in healthcare. All right. Those of you that are joining online, can you hear me? If you can tell me in the chat whether you hear me. I don't have my assistant today, so I'm kind of running both sections here. So let me know in the chat if you can hear me, please.
I forgot my workbook.
Okay.
Is there any way you have another?
Yeah, I've got.
Okay.
Yeah, we'll get there. All right. So we're going to start out today with bedpan. Actually, this isn't correct. We're actually going to start with range of motion shoulder. So if you go to page 76 in your book. Oh, good. You guys can't hear me. Good. There you go. That's okay. Go to page 76 in your book. We'll get to bedpan in a minute. But the skill that we actually need to learn first is the one that we didn't get to early in the program, and that's range of motion shoulder. So range of motion shoulder. And there's nothing to learn on this. We already know how to do our range of motions. We've learned it on the elbow and wrist. We learned range of motion on the hip, knee, and ankle. There's nothing new to learn here. But in order to know how to do range of motion on this patient, we have to look at the care plan. So if you look at the top of page 77, It'll tell you to provide the following range of motion exercises to the resident's right shoulder. It is right, correct?
Left.
Left. Okay, left shoulder. Flexion, extension, and abduction, adduction. So if you remember what we learned on range of motion, flexion extension is up, down. So to work on the shoulder, up, down would be up and down, like you're asking a question. Abduction, adduction is side to side. Now, when we do this, we're going to support at the joints. We're going to move slowly and smoothly, return all the way back to start, and watch for pain. We're going to do however many repetitions the care plan tells us to do. So in this case, it's going to be 3. So we'll do our opening, knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you? I need to do some exercises. Is that okay? Close curtain, wash hands. Everybody good with your opening? And then we're going to raise the arm above the head and then all the way back to the bed, supporting it. And we'll do that 3 times. 2, 1 more, 3. And then we're going to bring the arm out to the side like we're making a snow angel. 1, 2, 3. And then we'll do our closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Here's your call light. Environment's clean. Bed's in a low position. Open the curtain, wash our hands, and make any corrections. Then tell the evaluator our skill is done. That's the whole skill. They give you 4 minutes to do it. It doesn't take 4 minutes. It is a super quick skill. But I'm going to show you the video because it shows you really good close-ups from the top down so you can see how to support those extremities as we do this, okay? So let me pull the video up. This. And then I do have the bed I'll bring out during practice, and you guys can practice this.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing great. How about yourself?
I'm great. I need to do some exercises on your left shoulder. Is that okay?
Yes.
I'm going to close your curtain and go wash my hands. I'll be right back.
Okay.
Okay, I'm going to do a series of exercises. We're going to repeat each one 3 times each. The first one's going to be a flexion extension where I raise your arm over your head and back down to the bed, and we'll do that 3 times. Is that okay?
Okay.
I'll do all the work. All you have to do is let me know if there's any pain or discomfort.
Okay.
I'll stretch your arm out here to start. So we're going to raise it above your head and back down to the bed 3 times.
Okay.
Supporting at both joints. We're going to go all the way up and all the way back down. Feel okay?
Yes.
Any pain?
No.
We're going to go up again and all the way back down. That's 2. 1 more. Up and all the way back down. That's 3. Feel okay?
Yes.
All right, your next exercise is an abduction, adduction. We're going to swing your arm to the side and back in. We'll do this 3 times.
Okay.
Like you're making a snow angel.
Okay.
We're going to go all the way up and all the way back down. That's 1. All the way up and all the way back down. That's 2. All the way up. Feel okay?
Mm-hmm.
And all the way back down. That's 3. Are you comfortable?
Yes.
Can I get you anything, such as a magazine?
No. No.
Okay, your environment is clean. Here's your call light. If you should need anything at all, please let me know. I'll go ahead and open your curtain. And there's nothing else that you need?
No, ma'am.
Okay, I'm going to go wash my hands. Thank you.
Thank you.
After washing my hands, I'll review all the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay. Somehow when it kicked me out, it duplicated me. I don't know why. All right. We have a congratulations to get to here. Thank you, Nurse Pat, for helping me perform wonderfully on my CNA exam in January 2024. I've always worked in a nursing home, but just got employed in a hospital. I've continued to follow you. Congratulations. Great job. All right, those of you joining us live virtually, please bear in mind I do not have an assistant today, so it may take me a little bit of time to get to your questions. All right, so the questions on range of motion shoulder. I would want that skill if I were testing. That would be on my top 5 for sure. There's not much to it. As long as you're following the care plan, that's what they're looking for here, is are you following the care plan? As long as you understand that, it becomes pretty easy. All right, so let's look at page 147 to learn how to help somebody with a bedpan. Page 147. There is nothing new to learn. Nothing new to learn here. We know to follow the care plan. We know how to do our opening. We know that we need gloves if we're going to touch body fluids. We know when to put them on and how to take them off. We know to use a barrier if we're going to put anything on the table. We know the patient always has to be in the middle of the bed. We know that we clean all basins the exact same way. We know how to do our closing. All we really need to find out is the skill-specific steps here. Good? Questions on this? Nothing new to learn. All right. I do want to talk briefly about a barrier, though. For this skill, we're going to help somebody with a bedpan. Now, every other skill that we have supplies for, we put a barrier on the table and we put our supplies in the barrier, and you can do that for the test. No problem. You can put a barrier on the table and put your supplies on the barrier. I don't do that because this is your patient's eating surface. And even with a barrier, that's pretty high on my gross meter, right? So I don't do that. Excuse me. I leave the bedpan in the drawer until I'm ready to put it under the patient. That way I don't have to use this table. Make sense? Good? But you can. If you want to, there's no penalty for it. What they don't want to see is a bedpan placed on the table without anything under it. That's a definite no-no. So you can choose, use a barrier, put all your supplies out, make it easy for yourself, or you can choose to do it the way I'm going to show you and leaving the bedpan in the drawer until you're ready. Either way is okay. Down here, you'll see that somebody with your level of experience has 13 minutes to complete the skill. And it's going to be done on a live testing student, one of you. Before you panic, for the test, this is going to be a simulation skill. You're going to remain fully clothed. You're not going to pee anywhere. They're going to ask you to put a patient gown on over your clothing. Good morning. They're going to put a gown on over your clothing. You'll lay down in the bed, and then the person performing the skill will put the bedpan under you. Now, you're not actually going to pee in it, but they'll place the bedpan under you, and then they'll remove it and clean it. It's important that we follow the care plan here. And the reason that I say that is if you look at the top of page 148, when we look at the care plan, we can see that it says the resident has requested a bedpan. The resident is not wearing undergarments and is able to wipe self. So let's stop there for a second. This care plan says they're not wearing undergarments. That means that nobody should be helping you take your clothing off because the care plan says You don't have any. It also says that the patient is able to wipe themselves, but nobody should be in your personal space for this skill. Remember, we follow the care plan. Now, I'm going to tell you in a clinical setting, you may have to help somebody with that. That's this patient in this setting right now. This is subject to change depending on where you are and what your patient needs from you. But for the test, your patient is not wearing undergarments and can wipe self. Good? Make sense? All right. It says the resident is able to move as directed. So you can ask them to lift their hips. Makes it way easier. Just have them lift their hips. Bend your knees, put your feet flat on the bed, get your hips up. And then you just put the bedpan under the patient. It's not hard to do. But what if the patient can't lift their hips? Well, then we would use a turn method. We would turn them on their side, put the bedpan right up against their bottom, and then have them turn onto the bedpan. To get them off of the bedpan, though, you got to hold that bedpan down because as they roll off of it, it's going to tilt if you don't. But for the test, just have them lift their hips. The care plan says they can move as directed. Don't make this harder than it has to be. Good? Good.
But they have to stay in the middle, so when you turn them to the side, they'll be on the bed.
Right. This is one of those that you would scoot them towards you, turn them, put the bedpan under them, turn them back, and then you've got to kind of scoot them with the bedpan to the middle. It's complex. It's difficult. Yeah. Best case scenario in a clinical setting, because this won't be an issue on the test, but in a clinical setting, grab another staff member to stand on that side of the bed. Okay. That just makes it a little bit easier for you to put the bedpan under them. Good. But guys, that's not the important part of this skill. Putting a bedpan under the patient is not the important part. Taking the bedpan out from under the patient, not what they're grading you on. What they're grading you on here is actually the head of the bed. So let me show you what I mean. Actually, let me do this one. Okay. So if we have a patient, let's say this is our patient. Okay. We have a patient laying in bed. And we put a bedpan underneath that patient. What does that do to their middle? Raises it up. How many of you ladies can pee uphill? How many of you can push out a bowel movement uphill? This is not going to work. You guys see that? And even if a lady is able to push that urine out, it's going to run right up her back and into her hair. That's pretty gross. So when you put a bedpan under a patient, the most important step is to get them into a natural elimination position. This is what they're grading you on. Get the head of the bed up. But you can't get a bedpan out from under somebody if they're sitting on it. Yeah, they're pushing it down in the mattress. You can't pull that bedpan out. So you have to put the head of the bed back down to get that bedpan out. Make sense? This is the important step for this skill. Putting the head of the bed up and putting it back down. Now, with all of that movement of the head of the bed, whatever's in that bedpan is going to slosh around a little bit. So what could we put on the bed that might protect it? Waterproof, absorbent. Yeah, an underpad or truck. Absolutely. So for this skill, we're going to put an underpad under the patient. Clean rolls toward me, dirty rolls away. Put the underpad under the patient. Put the bedpan on top of the underpad. Put the head of the bed up. Give them their toilet paper and their call light. Now for the test, you have nowhere to go. You have no other patients to deal with. This is your only patient. This is it. So there's nowhere for you to go. You're just going to step on the other side of the curtain and wait. In a clinical setting, don't step on the other side of the curtain and wait. Patients need privacy. They're not going to be able to go if you're standing there listening. That's weird. awkward. So you need to wash your hands and leave the room. Go take care of somebody else. As long as they have their call light, they can call you when they're done. But for the test, we don't have anywhere else to go. We just have to stay there. So for the test, remembering it's a simulation skill, they're not actually going. As soon as you step on the other side of the curtain, they're going to say, I'm done. And you're going to come back and take that bedpan out. Now remember, it's going to be empty, but we're going to treat it like it's full. Now we have a principle. Never carry an open container of urine anywhere. That's just kind of common sense, right? We don't carry open containers of urine anywhere. So when I take that bedpan out from under the patient, I'm going to take the chucks with it, the whole thing. And I'm going to wrap that chucks over the bedpan to take it to the bathroom for disposal. Good? Never carry an open container of urine. So one of the things I worked on this weekend is I'm making class t-shirts for the next classes. You guys are the last ones that have to wear scrubs. The next class, we get a class t-shirt. And that class t-shirt has "For Your CNA" all spelled out, big letters. But inside are all of my principles written. So all of the principles are right there on the t-shirt. This one, never carry an open container of urine anywhere, is right in there because it is that important. Good? Make sense? Good. All right. So once you're done with the bedpan, you've taken it to the bathroom, you've dumped your pretend pee into the toilet, and you've rinsed it and dried it and put it away. We clean the basin the way we clean everything else. Rinse, dry, store. And you come back to the patient. They have wiped themselves. The care plan said that they wiped themselves. So what do they need to do if they've wiped themselves? Yeah, they gotta clean their hands. So when you're all done with cleaning the basin and you take your gloves off, you need to give them a hand wipe. I don't want to touch that hand wipe. I know where their hands have been. So I'm gonna get a paper towel to collect that hand wipe and throw it away. Good? Make sense? All right, so there's some controversy with this skill. I don't like it, but there's some controversy here. There are some people who say you do not use a privacy blanket for this skill. Now, technically, you can, you can get away with that as long as they're covered with sheet. But the problem is that we have urine under pressure hitting a flat plastic surface that's only this far away from their undercarriage, right? You've got pressurized. You're going to get splashback. There's no way around it. You're getting splashback. Well, that splashback is going to get all undercarriage, but it could also spray onto the sheet. I don't like that option. I don't think that I want to take that chance. So I use a privacy blanket, something I'm going to take off of the bed when we're all done here and put in dirty linen. But you can get away with leaving the patient covered with a sheet during this skill. This is one skill where the way I teach is not what's graded. So for this skill, you are not graded on using a privacy blanket. It's not required, it's not mentioned, it's not brought up. It's just not. But I think it should be. You're not penalized for using one, but you're not required to. Does that make sense? Okay. Step-by-step instructions listed here tells you exactly how to do this skill. Remember that we read the care plan. The care plan tells us the resident is able to move as directed. We're going to put a tucks under them, put the bedpan under them, put the head of the bed up, put the head of the bed back down when they're done, take the underpad and tucks out together. But the one thing I need you to understand about using a bedpan is it really is our last resort. I mean, we don't use a bedpan lightly. And there's a lot of reasons for that. First of all, they're uncomfortable, but there's a psychological aspect of this, which we're going to get to in a minute. So, because as a nurse, I understand this. If the patient is continent, remember if they're incontinent, we just do peri-care every 2 hours around the clock. It doesn't play into this. Incontinent patients don't use Bedpan. They just drip. But if they're continent, I've got to go through this whole process to figure out how we're going to toilet them. First of all, I got to find out, can they even get to the bathroom by themselves? If they can get up and go to, I'm not getting involved in that. Hey, you got to go, just go. I don't need to be involved in that. So if the patient can get to the bathroom, it's going to be bathroom privileges. This is often abbreviated as BRP. Bathroom privileges means they go on their own. We're not involved. Now, it may say bathroom with assist. That means that in some way, they're going to need some help, either help getting there, help sitting, help standing, help cleaning, help getting back to bed. I don't know what they need. Every patient is different, but it's just telling us, yes, they go all the way to the bathroom, but you're going to help them. Those are ideal. We like those. Bathroom privileges, they do it themselves. Bathroom with assist, we give some help, but we're at the bathroom. If the patient can't get all the way to the bathroom, we have a bedside commode. Now, that bedside commode looks like a little toilet. It's portable. We bring it right over to the side of the bed, and the patient uses it, and it's similar to a toilet experience. They still sit on it. It feels like a toilet seat. It's a much more comfortable process. And this is used when the patient can get out of bed but can't necessarily get all the way to the bathroom. They may use it independently, or they may need some assistance. But if they can't make it all the way to the bathroom, we look at bedside commode. Good? If those two things are not feasible, not possible, now we've only got two options left. One of them is a catheter, and we're going to talk about catheters in just a few minutes, but catheters are not used for convenience. Catheters are only used when the pee cannot come out on its own, or if the pee coming out can interfere with something else. We don't use them just for convenience. Make sense? Good? So the very, very, very last option here is bedpan. I got to go through all of that to get to bedpan. It's our last resort. Make sense? Good? The reason for that is psychological. You have been trained since you were about this tall, don't pee in the bed. Don't pee in the bed. Don't pee in the bed. And certainly don't poop in the bed. Just because I put a plastic pan under your butt does not mean your brain is going to let you pee in the bed. Do you guys get that? So there's a psychological restriction here, and it's very hard to overcome. And if you remember, we learned way back at the beginning of the course that memories that are made early in life stick. Well, these are some of the earliest memories you've created. So they're real good quality memories, and they're really going to interfere with your patient's ability to use a bedpan. So if the patient has a bedpan order and you put the bedpan under them and they try to go, but they can't, and they say, oh, I can't go, don't get mad at them. This is a very real possibility. We may have to try this 2 or 3 or 4 times before their brain will let them go. Now, there's a few things you can do to help your patient out, though. Few things. The first is turn the water on. There is something to the letdown reflex, the urinary letdown reflex, when we hear water. So that can help. Provide privacy. Nobody likes to go with an audience. So if the roommate is mobile, this is a great time to take them for a walk. Give them some privacy. If they're concerned about odor, we can preemptively do something about that. Use air freshener, put something in the bedpan that can help absorb odor, something like that. Does that make sense? but try to make this more comfortable for your patient whenever possible. The biggest thing is most people don't go with an audience. You got to get yourself out of there. Give them the time because they feel pressured. If you're just standing there, they feel rushed. They feel pressured. And people don't really go well when they're pressured to do so. So provide some privacy here. Make sense? Remember that we may have to do this a couple of times. A couple of times. All right. So the way that we do this is we ask the patient to lift his hips up. Clean rolls for me, so I'm going to roll that chucks towards me. With gloves on, I'm going to put that chucks underneath the patient, smooth it out. Once I get the chucks in place, then I can position the bedpan under the patient. Now, all of you have a bedpan in your bag. This bedpan, when you look at it, the wider end, the part that looks like a toilet seat, is where the butt goes. Not this end. You don't put this end under the bottom. You imagine sitting on that? That would be uncomfortable. So this end goes under the bottom. And you want to kind of center it, you know, where it needs to go. But the problem is we're going to put the head of the bed up. We have to. That bed is going to bend right where the patient bends, which is where the bedpan is. So when you put that head of the bed up, that bedpan is going to shift. It has no choice. The bedpan doesn't bend, so it's going to shift. It'll either shift forward or back. But when you put the head of the bed up, you can tell the patient if you need to adjust that. Feel free to do so. Good? Questions? Remember that you can't go lying flat. We have to put the head of the bed up at some point after we put the bedpan under them. However, we just put a chuck under the patient and a bedpan under the patient. We have juice on our gloves. Do you want to touch that bed controller with butt juice gloves? No. So what do we need to do before? Take the gloves off. That's right. So this skill will require 2 sets of gloves. One to put the bedpan in place, and then one to remove that bedpan. You want to hear something crazy? The test does not require gloves when you put the bedpan under the patient. It's not a checkpoint. It is for me, butt juice, right? But it's not required. Isn't that crazy? So you start to see that minimum skills competency really does mean minimum. Good? So take those gloves off, put the head of the bed up, and give them their call light and the toilet paper. Once you do that, you are going to go to the other side of the curtain and just wait. If you are the patient for this, you are going to be told to say, "I'm done." Once the patient says, "I'm done," you're going to come back around the curtain. You're going to put that head of the bed back down, put your gloves on, ask the patient to lift their hips, hold that bedpan flat, guys. Remove the bedpan and the chucks, wrap the chucks around the bedpan, take it to the bathroom, dump it, there's nothing in it, and then we're going to rinse it. After we rinse it, we'll dry it and store it using a paper towel like we do everything else, and then we'll remove our gloves and give our patient a hand wipe. I use a paper towel to collect that hand wipe. You don't have to, you're washing your hands right after, but I know where that's just been, so paper towel. After you do all that, then you can remove the privacy blanket. Put it in dirty linen, and then we'll do our closing. So in a clinical setting, acute care clinical setting, we're going to have something that looks like this. This is actually a picture of a toilet in the hospital. You can see the pipe coming up here, and then right up next to that pipe is something that looks like a little shower head. That pivots forward right over that toilet bowl. And when it pivots forward, it starts to spray into the toilet bowl. That is a bedpan cleaner. That's what it does. It allows you to clean the bedpans right over the toilet and dump all the contents in the toilet. But here's the problem with these. You have water under pressure hitting a flat plastic surface. in close range. You're going to get splashback. Not maybe, you will. So, do you want all of the stuff that was in that bedpan on your uniform? Do you want it to get any of the holes on your face? So, we need to cover all of those things to use this because of the potential of splashback. Does that make sense? So, we're gonna put a yellow isolation gown, one of those disposable gown things on. You've got those in your kits. You're going to cover your face with goggles and a mask. You have those in your kits before you use a bedpan cleaner. Now, you won't use this for the test. We don't use this for the test, but you do have them in your kits to be able to practice using them. Good? Questions? These are great. These are wonderful tools to be able to clean bedpans quickly as long as they're used correctly.
I have a question. So during the test, you still take it out of the toilet. You'll just put it like in the sink.
Yeah, you just rinse it in the sink, dump the rinse water in the toilet. Yeah, I wish we had these for the test. We don't. And that's because not all settings are going to have these. Usually just acute care settings, hospitals, rehabs. Some nursing homes, if they're newer, will have these. But it is helpful. Make sure when you're positioning that bedpan, you're putting it in the right way. That is something that they're grading you on. And I don't know why, but a couple of evaluators have told me recently that students are putting the bedpan in sideways. And I don't know why. I'm not real sure what their mindset is. But remember, if it looks like a toilet seat is where the butt goes. Okay? Questions on this? This is not a hard skill. It's a long skill. Oh my gosh. 13 minutes is a long skill. But it's not a hard skill. Any questions on that? Questions? All right, let me show you this video. Natalie, I'm not sure what page in the previous version. I'm not sure. I can't help you. Look at the table of contents. I'm sorry.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good. How are you?
Wonderful. I understand you need a bedpan. Can I assist you with that?
Sure.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, I'll need a Chucks and a privacy blanket for this skill. Okay, Mr. Jones, I'm going to place this privacy blanket over you. This will help keep you warm and protect your privacy as we do this skill. Is that okay?
Yes.
Okay. I'm going to spread this out without snapping it or shaking it. And I'll have you hold this in place so I can pull your sheet down. That way your sheet remains clean as we do this skill. Okay, I'm going to prepare a Chucks to place under you before we put the bedpan in place. I'm going to hold the Chucks up lengthwise and roll it toward me. Clean rolls toward me, dirty rolls away. And I'll just place this on the bed. I'm going to open the drawer that the bedpan is in and get a set of gloves. Okay, Mr. Jones, in just a moment, I'm going to ask you to bend your knees, lift your hips as high off the bed as you can, and I'm going to unroll the Chucks underneath you. Okay?
Okay.
All right, go ahead and bend your knees and lift up. Okay, and you can relax. I'm going to go around to the other side of the bed and unroll it. Okay, Mr. Jones, can you lift up again, please? smooth the chucks out, making sure it's positioned properly on the bed. You can relax. Okay, now I'll get the bedpan out from in the drawer. And I'm going to place this under your bottom, if I can get you to lift and relax. Is that comfortable?
Yes.
Okay, I'm going to put the head of the bed up, but let me remove my gloves first.
Okay.
Okay, I'm going to put the head of the bed up. Please tell me when you're comfortable.
Okay.
And you may have to adjust that bedpan a little bit as it moves. Tell me when you're comfortable.
That's good.
Okay, here's your toilet paper and your call light. And I'm just going to wait out here. Please let me know when you're done. Okay, Mr. Jones, I understand you're finished. Let me help you with that. I'm going to put the head of the bed down now. And please do not lift your hips. Once the head of the bed is in the lowered position, I'll put on a pair of gloves. And I'm going to hold that bedpan flat as you lift off of it. Okay, Mr. Jones, I'm going to take the corner of the chucks and hold the bedpan flat as you lift off of it. You can go ahead and lift on the count of 3. 1, 2, 3. Thank you. I'll remove both the bedpan and the chucks and take them to the bathroom for disposal. I'll be right back. Once I get over here to the bathroom, I'm going to unwrap the bedpan and we'll throw the chucks away. I'm going to empty the contents of the bedpan into the toilet, and then I'll rinse the bedpan. We'll deposit the rinse water into the toilet as well. And then we'll set the bedpan down to dry. I'll pick it up with a paper towel. I'm going to dry the inside. We'll throw that paper towel away. I'll dry the outside, throw that paper towel away, and get one for the drawer. Okay, I'm going to place the bedpan in the drawer along with the toilet paper. And we'll use the paper towel to close the drawer. Now I can remove my gloves. Mr. Jones, would you like to wipe your hands? Thank you. Okay, you can relax your legs if you'd like. And I'm going to pull your sheet up and remove the privacy blanket. We want to make sure that we roll the blanket in a ball so that any trailing edges don't contaminate other surfaces. There you go. Here's your call light. I'm going to go put this in dirty linen. I'll be right back. Okay, Mr. Jones, are you comfortable? Is there
Yes.
anything else I can get for you while I'm here? A
No.
magazine,
Thank you.
perhaps? Your call light is there. Please let me know if there's anything that we can do. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Jones, my name is Patty. I'm your CNA today. How are you? Good. I need to do catheter care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, and now I'll gather my basin and soap. And a set of gloves. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloths in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Miss Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Miss Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. I'm going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Miss Jones, can you scoot to the middle of the bed, please? Thank you. Miss Jones, can you scoot toward me? Thank you. And roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Miss Jones, and scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out and apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we washed. I'm going to hold it where it exits the body,
Wrap the washcloth around and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well, and we're going to soap 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf. Always going top to bottom, and then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom, fold that leaf over, clean down the other side of the labia, top to bottom, fold that leaf over. I'm going to clean the skin fold between the groin and the leg, fold that leaf over, and clean the other skin fold between the groin and the leg, and then set that washcloth aside. I'm going to take the final washcloth and wring it out really well, and we're going to rinse all of those areas the same way that we washed them. So I'll hold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over, clean down one side of the labia, fold that leaf over, rinse down the other side of the labia, fold that leaf over. We're going to rinse the skin fold, fold that leaf over, and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. Ms. Jones, I'm going to cover you back up. I'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not kinked. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be clean the way we clean everything else. We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll open the drawer with the paper towel and return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Ms. Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Ms. Jones. And scoot back to the middle, making sure the patient is not laying on that catheter tubing. Okay, Ms. Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the bed. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Ms. Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away, and then I'll remove my gloves. We'll throw those away. Okay, Ms. Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. You put this in dirty linen. Okay, Ms. Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just going to open your curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections that need to be made, and then tell the evaluator my skill is done.
Testing. Testing. Okay, those of you joining us online, see if you can hear me now, if I have fixed the sound. Just let me know if I fix the sound. There we go. All right. Everybody ready? So in your kits, can I just borrow yours real quick? In your kits, you have this and this. I need you to pull both out if you have not done so already. So this is called a triangular graduate container. Sorry, I'm stealing yours.
No, it's okay.
So it's in the shape of a triangle. It's got graduated markings on it, and it's a container. Most people will call this a urine measurer, not to be confused with a urine cup. A urine cup is a smaller, kind of looks like a large baby food jar, and that's for urine samples. That's different than this. This is used specifically to measure urine or other body substances, mostly urine. But there's other things that can come out of the body. Blood, emesis, which is vomit, feces, wound drainage. There's lots of things that can come out of the human body. So it's not just used for urine, but in general it is. That's why we call it a urinary graduate container. This is what we use to measure. Your drainage bag, my eyes are getting bad. Your drainage bag, if you unfold it, has markings on it. We do not use these to measure how much urine the patient has produced. This is a general guideline ballpark for the nurses. This isn't to be used as a measuring guide. So what we have to do is once a shift, we're going to empty the urine that's in this bag into one of these containers to find out how much the patient urinated. Good? So these two things are going to go together. And you have both of them in your kit so you can practice this at home. Infection control is going to be very important for this skill. So if you look down here, nothing new to learn. We know how to read the care plan, do our opening. We're going to wear gloves because it's urine. We'll use a barrier. This time it'll be on the floor. We're going to clean the basin like we clean everything else. And we're going to do the closing. Nothing new to learn here. If you look down here at the bottom, you'll see somebody with your level of experience should be able to do this in 9 minutes. You are emptying the urine from here into here and then cleaning. That does not take 9 minutes. They give you way more time than you need for this skill. But there are a few steps to this that don't take a lot of time, but you do need to know are your responsibility. But let's get into the care plan before we get into that. So here at the top of the page, on page 165, you can see the care plan. Empty the resident's urinary drainage bag into a graduate container and measure and record urinary output in mLs or cc's on the intake and output form. Good. You guys can hear me. Awesome. Okay. All right. So that tells us exactly what to do. We're going to empty the bag into the container, measure it, and then write it down on our intake and output form. That's it. That's all we have to do. Not very many supplies are needed here. Right here in the middle of the screen, though, you can see the intake and output form. So keep your finger there for a second and turn to page 169. Just a couple pages. you will see the intake and output form. This is the form that you'll be documenting on for the state exam. If you look at that form, there is a section for intake, and then there's a different section for output. What do you think urine is? Is it intake or output? I hope so. If you put this in the wrong space, you are legally declaring that this patient drank urine. You are legally declaring that. So do you think it's important for the test where you document this? A lot of people get confused. Well, I wrote it down. I just put it in the wrong line. Why is that a big deal? Well, it's a big deal because legally you are stating something that did not happen, that is not factual. So it's important that we understand even little details like this are pretty important on the state exam. So we're going to put the time. Military time is best. If you don't know military time, you can use regular time. But if you use regular time, so if I'm looking at that clock, it's 11:10, and I write 11:10, I have to put AM behind it. If you use regular time, you have to declare AM or PM. If you use military time, it would just be 1110. Military time is 4 numbers all squished together. No AM, no PM, no colon. 4 numbers squished together. Anything after 12 is going to count up from 12. So I always look at it this way. When I learned military time made so much more sense to me. I want to know who the guy was that said, yeah, there's 24 hours in a day, but we're just going to count to 12 and then just start over. Who did that? That's confusing. Why do we have to start over? Military time, we don't start over. We just keep going. So instead of starting over at 12, we just keep going. So 1 is 13, 14, 15, 16, 17, 18, and so on. You just keep going. Use all 24 hours. And it made so much more sense to me when you look at it that way. But I do have an activity in our book on military time, if you're not familiar with it, that'll teach you how to use it, because you don't have to use it for the test. You can use AM or PM, but you will have to use it in a clinical setting. So if you're not learning it for the test, you do need to learn it for work. Good? Questions? You don't use AM or PM. No. It's just 4 numbers all squished together. So if, let's say that it's 11:10 p.m. Okay, we're here at night. So it's 11 p.m. I would write 23:10. So 11 p.m. would be 23, and then 10 minutes is 10. So 23:10. So I don't need to put PM behind it. Yes, it's way easier, way easier. All right, so we learned this on the last skill. There's 2 different types of bags. There's the bedside drainage bag, and there's a leg bag. And it depends on your patient as to which one you'll be using. They empty a little bit differently. The bedside drainage bag is the one that you guys all have. This is the one we'll be using in the test, and it has a T valve. A T valve. So open up your bags. Not sure why I put mine away. So if you open up your bags, get that tubing out of the way. This is your T valve. Right now it lives in its little house. It's happy there. But we have to take it out of its house to empty it. Anything that port touches is going to become contaminated. That means that those pathogens will be able to get into the bag, up the tubing, and into the patient. So when we remove this from its little house, it can't touch anything. Nothing. Not the cup, not the bed, not the chucks, not your gloves, nothing. You cannot touch this end of the port. To open the port, there's a T valve. This T part, the little white thing that's sticking out, if you look through the hole, you'll see it's closed. If you slide that to the side, it'll open. Don't touch this end to slide it though. Keep your hand behind the T valve. Never go up here. Don't do this. Okay. You have to keep your hand under the T. So to close it, you just slide it the other way. You'll notice they're kind of stiff, right? Once you do it once or twice though, they loosen up. For the test, that bag has been used about 700 times. It's not new. So it'll be easier to slide. Don't pull. Don't pull. It's always push. So push. There you go. And then push the other way. There you go. Once you do it once or twice, it'll loosen up. Good? Everybody understand how to slide that valve without touching the end of the port? Now, when you're done, you take it out of its port, you open it up, you empty it into the cup, not letting that port touch anything. You close it back up, not touching the end of the port. And then we're going to slide it right back up into its house without touching anything. Don't do this. Okay. They want you to just slide it right into its house. We used to clean the end of these ports with alcohol. We don't do that anymore. If you were taught to do that previously, don't do that anymore. Alcohol is a drying agent, and it dried out this material, this composite material. And when it dried it, it created little micro cracks. Remember, we're using this for at least a week. And those little micro cracks formed, and that harbored bacteria. We actually found we had a much higher contamination rate when we cleaned versus not cleaning. So we don't do that anymore. Good? We just very carefully put it back in its house. But this is why we don't want this bag to touch the floor, because the port is going to touch the bag. So you don't want the bag to touch the floor. Does that make sense? Everybody good with that? So do you know how to undo your port now and how to close it? Always make sure that port is closed when you put it back in its little house. It's got to be closed when it goes back home. Okay, so patient will be lying in bed for the test. They usually use the mannequin. They can have a real patient in bed. Doesn't matter. We're not doing anything with the patient. Doesn't matter who's in the bed. There's a catheter bag on the bed, and it's going to be hanging from a non-moving part of the bed, hanging there, not touching the floor. We are going to empty that bag. To empty it, we're going to put a chucks on the floor. And then we're going to put the graduate container on top of the chucks. Don't touch the graduate container without gloves. It holds urine. We need gloves on. So chucks on the floor, get your gloves on, graduate container on the chucks. And then we're going to remove the port from its house, open the port, and direct the urine into the container. But you don't want to touch that port to anything. That's the big deal here. Don't let that port touch anything. To open the T valve, you slide it to the side. Be careful not to touch the end of the port. To close it, you slide it to the other side. This is a push, not a pull mechanism. Don't let that port touch anything. How many times have I said that now? Don't let the port touch anything. That is the big deal with this skill. Once the urine is in the container, we have to measure it. Now, this is a very specific scientific way of measuring, and you have to get all three of these to get credit for it. This container needs to be on a barrier, on a flat surface, and you have to measure it at eye level for it to be accurate. So you can't hold the cup up like this to measure it. Don't do that anyway. We want it on a barrier. It's urine. We need a napkin. We need something under it, right? We need a coaster of some kind on a barrier. It needs to be on a flat surface so it's not tilting. And then we have to be down at eye level to measure this. All three of those points have to be met. And then we're just going to measure it to the nearest line. So if you look at this, down one side is ounces, down the other side is milliliters or cc's. Which one do we use in healthcare? cc's. So we don't pay any attention to the ounces. They don't matter to us. We are going to measure using cc's. And if you look at this cup, you'll see that they're marked in 50s. So if we have a line for 350, a line for 400, a line for 450, a line for 500, and then there's little itty bitty lines in between, those are 25s. So if you go to 350, 375, 400, 425, 450, 475, 500. Do not write 410 mLs. There is no line there for 410 mLs. You're going to round it to the nearest line. If it's closer to 400, we'll write 400. If it's closer to 425, we'll write 425. Round it to the nearest line. Don't make up a number. Good? Make sense? Okay, so we're going to round it to the nearest line. And then we're going to dump it. Where do we dump it? Toilet is where it normally goes. So we'll dump it in the toilet. We're going to rinse it in the sink and dump the rinse water in the toilet. And then we'll dry it and store it the same way we dry and store everything else. Nothing new to learn here. After we have done that, then we can document. But we can't document until we have removed our gloves, done our closing, washed our hands. Then we're going to document. And then what do we have to do after we document? Wash our hands again. Good?
So we're going to squat down.
Yeah. Yeah, we have to get down to see it at eye level. I know this is a tough skill. I just retaped all these skills last month. Oh my gosh. This one in foot care about killed me because I don't get down. Well, I get down okay. I don't get back up very well at all. So I know this can be problematic, but we have to be able to measure it at eye level. And for the test, we're going to use the seat of the toilet as our, or the lid of the bedside commode as our flat surface. They have a bedside commode. Yep. So we'll use that. So we're going to go through these steps. We'll do our opening. We're going to place the barrier on the floor. We'll get our gloves on. We'll get our urine graduate container. We'll open the port, empty it into the graduate container, not letting that port touch anything. You can tilt the bag for easier emptying. You can do that. Don't raise that bag above the level of the patient's hips, though. Get the difference? You can tilt the bag, though. We're going to close the valve, return it to its storage, not letting it touch anything. Wrap the chucks around the graduate to transport it to the bathroom because we can't carry an open container of urine anywhere. When we get to the bathroom, we're going to set it on the lid of the bedside commode, get down at eye level, and read it. After that, we'll empty it into the toilet, rinse, dry, and store our basin like we do everything else. Remove our gloves, do our closing, document, and then wash our hands again. That's it. This skill, even though they give us 9 minutes to do it, usually takes about 4. It's a very short skill. There's nothing really with the patient other than the opening and the closing. We're not doing anything with the patient. But I do want you to look at that bag. If it's touching the floor, we've got to do something about it. If the tubing is near the floor, we have to do something about it. If the patient is laying on the tubing or it's kinked, we have to do something about it. But you also need to be looking at the urine, because the urine can tell us a lot about the health of the patient. If there's only a little bit of urine and it's super dark, we need to let the nurse know. If there's a lot of urine and it's very light, looks like water, we need to let the nurse know. If it's a strange color, like purple or red, and yes, purple is a thing, by the way, or red, we need to let the nurse know. If it has a strange odor, like grape Kool-Aid or maple syrup, we need to let the nurse know. So we're going to pay attention to the urine and then notify the nurse if anything looks off or smells off. Remember, as a CNA, we use our senses, not just sight. We use our, not taste though, don't do taste, but we use all the other senses. Okay. Bless you. Good? All right, I'm going to show you this video. When you see this on the screen, I actually zoom in so you can measure this urine on the screen, and I'm going to pause it for you so you can see if you know, you can figure out how much urine is in there.
Hello, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not kinked, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest.
How much do you think is there? Everybody see that? Okay.
Line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters or cc's. Once we've measured it on a barrier on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside.
Remember, the whole reason you're setting it down is to be able to spray it if your facility requires that, to disinfect it.
Paper towel to dry the inside. And we'll discard this, and then one for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call light there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
Okay. Any questions on that? Any questions? We have now covered all skills. You are completely done with skills. Was it hard? Do you find the class difficult? Anybody? Challenging? A little bit challenging? Is anybody lost on anything? Is there anything I can help you understand a little bit better?
I have a question about the WIC. Do they just teach you that in the hospital? Because the CNA was doing that with my.
A Pure Wick?
Yeah.
So I have a lesson on the Pure Wick in your book. Can I borrow your book for a second? I know I pick on you.
It's your book,
Oh.
actually.
I've seen it in there, but I didn't know. if it was
Okay.
gonna be on the-
So the Pure Wick that she's talking about is going to be on page 155. It's an automated collection device. Well, let me explain to you what a Pure Wick is. I don't have any slides on this, but let me explain. So for men, we have that external condom catheter or Texas catheter that we talked about that attaches to a urinary drainage bag, but it's external. It's not inside. It's on the outside. Well, for women, we have something similar to that that is called a Pure Wick. And it's like a cottony, banana-shaped item that goes in the peri area, and it works on suction. It pulls the urine away as it comes out of the patient. So we use this for incontinent patients. Again, it's external. We use it for incontinent patients. They're not used in all settings because they are expensive. They're becoming a little bit more mainstream, but they're not used in all settings. But it is preferred because it doesn't hold the urine right up. You know, it suctions that urine away. Now, that Pure Wick does need to be changed out, though. And the care plan would tell you how often it needs to be changed, and you would have to be trained on how to change it. But it's just like the catheter. It attaches to a drainage tubing. So you would want to make sure we're using really good infection control processes, and you would not do that unless they had trained you to do it. Remember, we talked about delegation. All other tasks outside of what we're learning in class, You can be trained to do, but you have to be trained. And not all settings will require all tasks. Any other question? Good question. Any other questions? No?
What about EKGs?
So again, you would have to be trained. And yes, you can. Again, that's definitely something that you can be trained to do. Taking an EKG is one thing, being able to interpret it is something else. So there are a lot of CNAs that work as monitor techs. So they took a CNA class that was offered by their facility, usually, and they sit in front of a bank of monitors for patients that are being continuously monitored. It's called telemetry. And their job is just to watch these monitors and find anything abnormal. And when they see something abnormal, they notify the nurse, who then goes checks on the patient. So yes, that is a possibility, called a monitor tech, of another healthcare career option. And a lot of CNAs go into that, what we call it a modality. But most facilities will offer EKG training if it's going to be part of your work requirements. EKG techs, it used to be years ago that hospitals would hire a person to go in and put all the little patches on, right, and take an EKG. We don't do that much anymore. It's not really like an independent job anymore. Now it's just done by CNAs or PCTs or nurses, or we tend to streamline the amount of people that are taking care of the patient. The fewer people we have, the better we are at noticing things when they come up with the patient. If you've got a million different caregivers in there doing all different tasks, they're all focused on their own task, and things get missed. So the trend now is to consolidate all of these tasks with a few caregivers. And we seem to have better patient outcomes that way. Good? Good question. So I do want to talk to you about that. I usually talk to you about this on graduation day, but I want to touch on this real quick. A lot of CNAs, once they get done with CNA training, start looking around for other classes to take, other certifications to get. EKG is one, phlebotomy is one, seclusion and restraint training is one, Alzheimer's is another. So there's a lot of additional things that you can get, but not all of them are going to benefit you. You guys are already in demand. You will get hired. It's not like you have to pad your resume with a whole bunch of stuff to get noticed. It depends on the setting you're working in as to what certifications are going to be useful. If you're working in a hospital, having Alzheimer's training is not really going to help you. They're not looking for that. If you're working in a nursing home, EKG isn't going to help you a bit. They don't do that there. If you're working in mental health, phlebotomy isn't going to do a thing for you. So you really need to start thinking about where you want to work and then tailor additional trainings to that setting. If you want to work in a hospital, getting your med tech, that's not going to benefit. They don't use med techs. They use nurses to give meds. But if you're working in assisted living, they use med techs all day long. So it depends on the setting that you're looking to get into. And that's where that workplace personality quiz will help you. If you take that, figure out, okay, assisted living really is the way I need to go, then maybe I need to consider my med tech. Good? Does that make sense? But don't just go out there and get a whole bunch of certifications thinking it's going to make you more marketable. It doesn't. And in fact, it can actually work against you. And the reason for that is if you've got you know, your EKG, your phlebotomy, your seclusion, your Alzheimer's, your med tech, you got all these certifications, you're going to want more money. You've paid for those certifications. You paid with time and money, so you're going to want a higher wage. So that employer isn't going to find you more attractive. They're going to find you more expensive for skills that they aren't even using. So be careful about that strategy. It can actually bite you.
What would you say like a new CNA usually gets hired at?
Depends on the setting. And there's it's really hard for me to answer that because it's the law of supply and demand. Everybody wants to work at a hospital. I don't know why, but everybody wants to work at a hospital. They have a million applications. They don't have to work hard to hire somebody because everybody's at their doorstep. They're not going to pay as much. Why would they? They get, you know, applicants all day long. Nobody wants to work at the nursing home. So in order for them to get staff, they've got to give a higher pay. They got to entice you to come in. So it depends. It also depends on the types of patients you're caring for. If you're going to be caring for one person in the home, you know, that's a very low stress environment, you're going to get paid less. If you're going to work in a nursing home that has a lot of high acuity patients that require a lot of care, then they're going to pay you more because of the job requirements. Then you've got shift differential in there, and you've got to take into consideration whether it's a full-time with benefits or PRN, no benefits. So all of that's going to go into deciding how much you're going to make on an hourly basis. So with all of that being said, generally speaking, about 18 to 20 an hour is what we're, you know, kind of averaging out in our area. Some places are going to be a little more. Some places are going to be a little less. Just depends.
Is the night shift usually 8 hours? And do you just do something when their call lights on, or is it going to be a list? It wouldn't be as busy at night as the daytime, I wouldn't think. I don't know.
So I'm going to take each one of those questions separately. First question was, is the night shift usually 8 hours? And the answer is, it depends on the setting. Hospitals work 12-hour shifts. Most nursing homes have switched to 12-hour shifts, but there are still some that do 8s. So it depends. As far as what you do on the night shift, it depends on the shift. Is it an 8-hour or a 12-hour? If you're working 11 to 7 and all of the patients are asleep, well, we still have to change incontinent patients every 2 hours around the clock. We still have to turn immobile patients every 2 hours around the clock. And our dementia patients don't sleep like we do. They don't sleep through the night. There's something called sundowning, and they generally are very active at night. So, you know, night shift often has a much harder time if you're working with dementia patients because they don't sleep, and they tend to require a lot more redirection at night. Exit seeking is very common at night. If you're working in a hospital, well, yeah, doctors aren't rounding at night, sure, but you're going to have a whole lot more patients to care for. And we still have to do vital signs. Some of your patients are on every 2-hour vital signs or every 4-hour vital signs. Blood sugar sticks, which you can be trained to do. So the setting really is going to dictate what we do. Assisted living, very little that we would do with patients overnight. Now, if you're working 7 to 7, that changes things because if you're working 7 p.m., now you're getting the patient ready for bed. You're doing PM care, getting them undressed and cleaned up and ready for bed, and making sure they get their bedtime snack if they need it. So there's a lot of that to do. And then you'll be cleaning equipment. Wheelchairs have to be washed, and you know, dining room tables have to be cleaned, and there's a lot of environmental stuff that you would be doing in addition to patient care. And where day shift might have 12 patients, you have 28 because you're not doing as much with each one. So every shift is going to have their own challenges. There isn't anything called an easy shift in healthcare. Does that help? Probably the easiest, honestly, would be one-on-one home care. That's going to be, I call it low key. It's, you know, because you're not having call lights. There's not frantic activity. It's very low key. But if somebody is paying you for individualized attention, they expect individualized attention. They're not expecting you to sit on the couch and watch TV. You know, even though it's a low key environment, they want 100% of your attention. So it can be very emotionally draining to work in those environments. Good? Questions?
What about rehab facilities and rehabilitation?
So rehab fits right in between, smack in between hospitals and nursing homes, home care. Right. Literally, that's where it exists. So a hospital is going to stabilize you. A rehab is going to try to get you as independent as possible. And then when you leave the rehab, you're either going to go home or a nursing home. That's pretty much your options. So it's going to be more energetic, like a hospital, because your patients are still pretty sick. They're getting better, but there's still a lot of care required. But you've got them way longer than you would have them in the hospital. So they start to resemble a little bit more of long-term care. So you're doing more with them, but you're keeping them longer. You also get to see their improvement, which can be very rewarding if that, you know, if you thrive on that kind of stuff. So rehab kind of sits right in between the two. Yeah, right in between the two. Yeah. Yep. That's probably honestly where I would probably thrive in that environment too, because there's still enough change to keep me interested, but enough consistency that I get to know my patients and can spoil them a little. If you go on to 4YourCNA.com, under the training menu, you'll see your ideal workplace. Yeah. It'll also be in the wrap-up email too. Is everybody getting the wrap-up emails? Okay. Do you find them helpful to have immediate access to everything that we go over? I know I shove a lot of information at you. It can get overwhelming. I get it. I understand. All right. So that's going to be it for me today. That's all I have to teach you. I'm going to go ahead and sign off of our virtual, and we'll say goodbye to those individuals. And then I'll pull the bed out and set it up for you to be able to practice what we've learned so far. On Wednesday, you need to bring your yellow book back to me. The white book is yours. You don't need to bring the practice kit, but the yellow book you need to bring back to me. We will take a class photo on Wednesday as well. So keep that in mind. And you will probably have about an hour and a half of practice time on Wednesday too. Okay. All right. Those of you who joined us today, thank you so much. And I apologize for all the technical difficulties. I didn't have my assistant today. He's feeling under the weather. So Jacob, we hope you feel better and can come back on Wednesday. Other than that, I hope to see you guys all on Wednesday for graduation. Next Tuesday is the next game show, and I have a week off in between classes. So the next class will start February 10th. Till next time, happy caregiving. Bye.